The history of micronutrient malnutrition is a very interesting one, and food fortification represents the most critical and applicable solution. For example, in the 1920s, rickets, vitamin D deficiency, affected almost 80% of children in the United States, and today has virtually been eliminated by the fortification of milk with vitamin D. Prior to World War II, or at the time of World War II, 30% of Americans were ineligible for military service because of nutritional deficiency. This led to the establishment of the Food and Nutrition Board in the United States, which is now the group responsible for making recommendations about nutrient intake and is one of the world leaders in this regard. And the first recommendation of the Food and Nutrition Board in 1942 was to recommend flour fortification in the United States with niacin, because pellagra, which was a consequence of niacin deficiency, was still widespread, and some of the B vitamins. Iron has subsequently been added, and that policy has been in effect until today. Now, why is the Centers for Disease Control interested in this problem? Well, let me give you some background about the Centers for Disease Control. We are an agency in the Department of Health and Human Services. And as you can see from this slide, we are the centers, plural, the Centers for Disease Control and Prevention. We're known as the CDC. There are a number of elements within the CDC that are very interested in this problem. And as you can see, the Office of Global Health, where Bob Baldwin sits, is in the Office of the Director. So at the highest level, there is recognition of the importance of international health to our agency. We are from the National Center for Disease Prevention and Health Promotion. This is one of a number of centers at the National Center at the CDC, and we are assisted in our work by the National Center. Thank you, Abe. How do I work this? We are assisted by the National Center for Environmental Health, which is a laboratory, and the National Center for Birth Defects and Developmental Disabilities. My division is in this center, and I am the director of the Division of Nutrition and Physical Activity. So that from the organizational perspective, we are represented both across centers and in the office of the director. Now, why are we interested in micronutrient malnutrition? The origins of the CDC and the disciplines for which we're best known are infectious diseases. We have worldwide activities around these issues. We have had a very prominent role in polio eradication around the world. But the diseases of this century are not going to be the infectious diseases. They are going to be the chronic diseases, and the diseases of micronutrient malnutrition rank very high on this list. They are a very easy target because with a relatively modest investment and in flour fortification, we can eliminate iron deficiency anemia. We can eliminate birth defects. This is a very important goal. The way the CDC works is through ministries of health within countries to build the infrastructure necessary to approach these diseases. And by infrastructure, I mean the capacity to assess how frequent these problems are and how successful interventions are that are directed at them. Today, we're going to be talking about universal flour fortification, but I think it would be remiss if I didn't mention that there is some disagreement about the terms that we should use. There is no question in anybody's mind that we should be talking about flour fortification. But some people, and most of us here, would argue that this should be universal, all flour everywhere for all people. Others think that this should be directed at flour fortification for all people. And the semantic difference I don't think we should spend a lot of time on. I think we can all agree that flour fortification is the goal of this meeting. What we would like to do this morning is to define the scope of iron and folic acid deficiency, to identify the potential role that the flower industry can play, and to clarify the role of public-private partnerships. And I'd like to spend a few minutes on this issue of public-private partnerships. From the public health perspective, flower fortification is a critical goal. But we recognize that the role of public health is to create demand for the products that you produce. That the ideal relationship here is industry meeting a consumer-driven demand. And it's the role of public health to create that demand. And we're prepared to do that by working through existing country infrastructures around these issues of iron and folic acid deficiency. But we need your help. We need to understand from you the barriers that exist to this approach, the limitations of this approach, how we can help you achieve flower fortification. And if we come away from this meeting with a clearer idea of the strategies that we need to implement to help you do your job better, this meeting will have been a success. Now, this morning there are a number of presentations, but throughout this discussion, we want to be sure that you help us identify the next steps. What do we need to do to help this issue progress in your country, in your mill? Because this is really a strategic, as much a planning session as it is a strategic planning session. And if we come away, as I said, with strategies that we can begin to implement together, this meeting will have been a success. So thank you again very much for coming this morning, and we are very pleased again to be working closely with MI to move this forward and look forward to cooperating and supporting your efforts. Thank you.